Nearly 2.5 million Americans, mostly women, will have Botox treatments this year, and more than 15% of the treatments performed on people in their early 30s, actually even younger than that. So how young is too young for Botox? The age of some seeking these cosmetic procedures does raise some eyebrows. Danny Beck is 22 years old, arriving at her doctor's office for Botox injections.
Even though it's a young age, I started, I got about a couple rounds and I really enjoyed it.
Melinda Farina is 26.
You're never really too young for anything, but as long as you do it in moderation and you don't go crazy with it and you keep it natural.
We can slow the aging process down, and I think those patients can be good candidates. Now, does that mean that 25 should be the right age for everyone? Absolutely not. It's by case by case.
Cosmetic procedures are generally safe once a patient has stopped growing, and psychologists see a favorable aspect too.
When kids are in their teen years, that's when braces come into play. That's when going to the dermatologist to clear up the acne and make sure that you have smooth skin all becomes important, because appearance does matter.
25-year-old Jamie Evans is here for her regular Botox.
Hey, Jamie.
Hi.
How are you? Good to see you again.
But as a longtime sufferer of migraines, she found relief with the injections, along with a positive side effect.
I did notice that I was starting to get wrinkles, and it wasn't my main purpose for getting Botox, but it definitely added to the results of it.
In Evan's case, Botox injections are partially covered by insurance, but at about $750 per syringe, there is a question of young patients being able to afford the procedures.
I don't go shopping every weekend, that some of my friends do. And
I've definitely put myself into credit card debt at an early age, but now, I've definitely come into my own and my own career, so it's affordable at this point.
I've turned patients down when we see that they're trying to run up their credit card bills or they're maxed out. I'll have them come back in 6 months, in 1 year, when they've gotten all of their financials straightened out, and then if they're ready for the procedure, to do it.
Dr. Trokel adds that patient consultations are a necessity prior to the procedures.